asthma, diabetes, hypertension. They're off the charts.
And a single-payer health plan, the only one nationwide providing universal care, could change that, according to the Northwest Bronx Community and Clergy Coalition. They joined Community Board 7 for a forum at St. James Church on the New York Health Act.
The first thing it does is it covers every New Yorker. Every New Yorker, whether they are documented or not, as long as they are a resident of New York State.
With no copays, no deductibles, or out-of-network charges, the bill covers a host of areas including dental, vision, reproductive care, opioid addiction, and more. It has passed the Assembly 4 years in a row and for the first time goes before the State Health Committee, chaired by State Senator Gustavo Rivera, at the start of the next session in January.
This healthcare system is broken. It's a train wreck.
Also speaking here was Leonard Rodberg, who shared that if legislation like this was passed around the country, it would place the U.S. on par with other first world countries that already provide this.
Yet long-term care is incredibly expensive. On average, it costs $120,000 a year to receive long-term care. And if that's something that we need from the time that we are, say, 75 or 80 for years on end, that could mean that we work our entire lives, save our entire lives, and then find that when we need that support to stay in our homes and in our communities, it doesn't exist.
Long-term care has been another concern for aging residents. The New York Health Act looks to address this while also building a workforce focused on job development. For more information on the New York Health Act, go to northwestbronx.org. For BronxNet, this is Arlene Makoko.